All right. Hey, everybody, and welcome to the Health Transformation webinar. This is your host, Cade Archibald, and really excited to be here with you guys. And we got some really cool stuff we're going to cover today. And as the usual, we got the one and only founder, creator of East West Health and Your Healthy Self. This is Regan Archibald. Regan, how are you doing?
Good. How's everyone doing out there?
They are doing great. We got people joining as we speak. So let's today. So for those of you that were on last week, we talked about our wellness retreat. So we're doing a retreat center, a retreat day at it's in downtown Salt Lake. So you guys gotta check that out. It's on our website, so you can look it there, or just call into the Salt Lake office. If you want to participate in that. It's going to be a full day of just amazing healing and wellness, some education, some cooking classes, or a cooking class that you're going to actually eat what you cook. So bring your A game and have some fun with it. Get some treatments, acupuncture, ozone. We'll be doing different infusions. So it's going to be an amazing day. Friday, September 6th. So for those of you that are interested in that, make sure you reach out to the clinic on those. All right. Well, let's dive into today's topic. We're going to be learning about some cool vitamins that can really up your game with your health. So Regan, let's jump in.
Okay. So I've been receiving a couple of questions from you, and you've wondered, hey, I've got bone spurs. I need to get my arthritis taken care of, but is there anything we can do about the bone spurs, or do I need surgery? And so here's what I'm going to do. I'm going to present a case study. I'll present some research, and I'll kind of show you guys that there's actually ways of using some essential vitamins to dissolve bone spurs. And there's some very cool clinical applications and clinical studies on this. So this is a case study that comes from one of my colleagues, Danny Rasmussen out of Seattle. He had a 56-year-old female patient. She had clicking in her left hip joint. She was diagnosed with arthritis and bone spurs by an orthopedist who was recommending a surgical removal of the bone spur. And on examination, it was to determine if she was a good candidate for stem cell therapy. Indicated that first we've got to address removal or dissolving of the bone spur, and that needs to be part of the overall treatment program. And so what we did is, in addition to her functional medicine program, she was put on 30,000 IUs of vitamin D3 daily with 300 micrograms of vitamin K2 daily. We put her on the ketogenic, more of a bulletproof style, time-restricted eating diet. And in 3 months, the clicking of the left hip completely disappeared and pain had decreased by 70%. We then proceeded with stem cell therapy injections, resulting in 100% pain relief in 1 month. So that's a pretty powerful story there. And so for those of you who have bone spurs, this is something you really want to pay attention to. Even if you don't, but you get calcifications, if your knuckles are starting to get large or your fingers are starting to curl at all, this would be very critical for you to stay tuned and to really get this dissolved. So here's what we look at. What causes bone spurs in the first place? Because the easiest thing in medicine is to prevent these diseases from occurring in the first place. And so one of the things that you look at is any condition that is acidic in the environment of the body will create an environment where bone spurs can develop. And so you want to make sure you're on a diet that is alkalizing your blood, and that means eating dark leafy greens, which are loaded with magnesium, and cruciferous vegetables. That's going to detoxify your liver. That will also negate a lot of those estrogenic factors in the environment. You can do blue-green algae, spirulina. These are all very phenomenal ways of keeping your body in that state where you can prevent these bone spurs. And so, Cade, what's the hardest thing for our patients in getting them to eat more of an alkalizing diet, or just getting their vegetables in? That's all we're asking, kids. Just eat your veggies.
Just eat your veggies. Yeah, it's just tough to get creative with getting it. Sometimes it's a taste factor. We'll talk to people that just have never liked vegetables, and they're used to their mom and dad telling them they got to eat their vegetables. And I think a lot of times that creates even more resentment and resistance. It's like, mom and dad told me to, so I'm not.
I'm going to rebel.
Yes. Yes. And I think we can all relate with that, whether we're parents or not, I think it's finding what works for you and has a good taste. What I find, like, I actually used to not like much vegetables or leafy greens at all. And now, like, I find myself at Harmon's just like loading up on all the greens I can, and avocado and cucumber, and then just put like olive oil on it. And I dig that.
Yeah.
Yeah.
That's what I do in the morning.
With it, it makes a world of difference.
So nice. And so, that's kind of the bottom line. You got to eat your vegetables, but if you have bone spurs that have developed, the thing that we're looking at East West Health, or in our Go Wellness facilities, is we want to give you your health independence. We want you to be able to move freely, to think freely, to breathe freely, to eat the right foods. And you can't do that if you've got big old bone spurs, because your joints aren't going to move as adequate as we'd like them to. Things are going to stick. You're going to get tendon damage. And so bone spurs are also called osteophytes. So if you ever see that, a lot of times I'll read an MRI and the radiologist will say, oh, you've got osteophytic, degeneration in the hip joint. And so we'll say, okay, well, let's up the vitamin D. Let's get the vitamin K going. But there's some beautiful things when we do the stem cell therapy or regenerative medicine. One of the molecules in stem cells is called MMP9. And this MMP9 protein is a proteinase that actually can help dissolve a lot of the calcifications and bone spurs. And then if you're blasting that in the hip joint or the knees or the shoulders, wherever you may have the spurs, even in the back, if you've got degenerative disc disease, it's not uncommon to have these osteophytes build up. But the MMP9 will help dissolve those. And then if your body's on this constant high dose of vitamin D3 and the vitamin K2, that's where you can actually have some massive breakthroughs, and you can get your health independence because you don't have to depend on a surgery. Because as we've learned, in the United States, we are the most operated on. We have more surgical procedures per capita than any place in the world. We're also the most heavily medicated, double the next country. I mean, double. We're taking twice the medications. We have almost twice the surgeries as any other country out there. And we're 42nd in life expectancy. And so these stats are staggering to me. And I say, man, I'm on a mission to transform healthcare. Let's do things differently. And so let's dive into some of the research on vitamin D3. There's a lot that's been released. And vitamin D3, by the way, it's a hormone. And this hormone is a precursor for your estrogen, your progesterone, your testosterone. Vitamin D3, if we find that yours is below about 30 on a blood lab, even below 40 in some cases, we know that there's a good chance you have autoimmunity propensity. And so we got to get your vitamin D levels up in order to negate some of the autoimmune conditions. We've even seen this in MS patients where we give them high doses of vitamin D infusions with regenerative medicine, with like a stem renewal program. And what happens is their MS symptoms starts to go down. So very powerful. So anyway, this is the study. Did we have some questions coming in?
No, just Laura wanted to say good morning.
Good morning. Good to see you guys. So if you look at, so here's the study. It was published, I think it was in 2017, and it's vitamin D3, the bone and joint remodeling hormone. So it's a bone and joint remodeling hormone. Not only that, it remodulates your immune system, regulates your hormones. It's a powerful supplement. So vitamin D3 is a hormone that regulates the activity of osteoclasts, and this is bone reabsorption, and osteoblasts, bone formation. So that's one of the things the researchers discovered. And what they found is that deficient levels of vitamin D leads to dysregulation of osteoblasts, can cause abnormal calcification of bone modeling, contributing to bone spur formation. also contributes to abnormal calcium deposits in arteries. And so this is very interesting because if you're ever taking calcium, which we've all been led to believe that milk, it does a body what, Cade?
Milk, it does a body good.
That's right. And
I just need the milk mustache.
My kids had it in their school last year. There's a poster of milk, it does a body good. And it's got like the athletes and they're all drinking their milk and they're all swimming in cow pus and and so homogenized milk, pasteurized, all the nutrients are gone. But really then they say milk is powerful for the bones. If you have osteoporosis, osteopenia, you need to drink more milk and get more calcium. And it's like, well, yeah, but you need that calcium is great because milk has vitamin D in it. Not if it gets stripped out, like the whole milk, it has vitamin D. Your milk, that's skim milk, like Cade and I grew up on, or 2%, it's got all the fats removed, and vitamin D is a fat. It's a fat-soluble hormone. And so very interesting, but vitamin D is really the key component of moving calcium around your body. And calcium is the most abundant mineral in our body. I mean, if you think of our bones are very dense and there's a lot of calcium there. Calcium is also very interesting because if you have a high fever, one of the ways you can get that fever down, and I've used this on my kids, used it on myself, but you want to add in more calcium and vitamin D, because what happens is you have a fever so that the body can strip the calcium from the bones, and then the ionized calcium molecules surround the virus or the pathogen or whatever's causing that fever. And then once it surrounds it, then that's when the macrophages can come in and destroy and eat up, engulf that bacteria or that pathogen that's destroying your immune system, and then your body flushes it out. So calcium is very powerful, but if you don't have vitamin D, it doesn't have the carrier. So it can't move around the body freely. And so if you have deficient levels of vitamin D, this is where you get the calcifications in your arteries. And so, and that's where you can also, once again, then that's where those calcifications will transport out into your joints, and you'll start getting these bone spurs. So one of the keys is lots of vitamin D, and not by drinking milk. You want to watch out for the milk. So here's where you can see in a healthy bone and a deficiency bone. So you can see on one side, let me move that screen for you guys there. But vitamin K2, it activates the hormones that help improve the bone structure. So there's where you guys can see that the difference in if you have a deficiency in vitamin K2, you can see on a microscope image, there's a lot of black areas. There's a lot of deficiencies in that bone structure. And this is going to lead you to get one of those diagnoses like, osteoporosis, osteopenia. You're going to have the demineralization of the bone structure. So your phosphorus levels are going to be depleted, calcium levels, magnesium levels. But then you can see when you have healthy bone, there's nice density there, very strong, very powerful bones, and that's where we want to get you to. But here's what we found is if you have a vitamin D deficiency, you'll have excessive amounts of calcium that get deposited into the arteries that can lead to stiffening, and that is a cofactor in heart disease. So if you have heart disease, you want to keep your vitamin D labs up in the 80s. I have one of my patients she keeps hers at 100. But we always are looking at our kidneys because vitamin D is a fat-soluble molecule, and it can stress out your kidneys if you're taking too much of it. So make sure you're working with your medical provider before you try a protocol like this. Your kidneys need to be healthy before you just start dumping in 30,000 IUs of vitamin D. So something you want to look at.
Had a question come in, and I think you touched on it there. But where can you be tested for supplemental absorption? I'm assuming you're referring to vitamin D. Simple blood test, is there a better option than doing blood?
No, blood test is where we're looking for vitamin D levels. You can look at, there's some hair tests out there. I just don't think they are as potent and accurate as blood. So
perfect. Yeah, so you can look at it. Ideally, you want them around, you're saying around 80? or as high as 80 as long as your kidney function. So that's looking at GFR, creatinine levels.
Yep.
Awesome.
Beautiful.
Another comment just came in, found magnesium helps to enhance calcium absorption as well.
Yes, yes. So magnesium, ideally you're going to have about 4 parts magnesium, 1 part calcium. So, and magnesium especially, I appreciate you, mentioning that, because with all the EMFs we're exposed to, and the negative ions diminishing, because negative ions, you'll find those in nature. You'll find that around running water with those Himalayan salt lamps. Those are really powerful, but our magnesium supply gets depleted. And that's where it's really important to, if you're ever flying, take more magnesium. If you're really sensitive to your cell phone or to EMFs, get your blue light blocking glasses. Mine are over there. I should have put those on, but I guess you guys get to see my eyes today. No Bono effect. But it's really important to take the magnesium as well. And ideally, taking about 400 milligrams before bed at night is a great way to just relax your body and get things going. And ideally, if you have 4 parts magnesium, put that 1 part calcium in there. So that would be 100 milligrams. Okay, so great. The other thing the study revealed is vitamin K2 activates the matrix GLA protein, it's called MGP, to prevent calcium deposit in the smooth muscle cells of the vascular system. So vitamin D and vitamin K2 need to be used together. That's going to be critical. You're going to find vitamin K in your leafy greens, your cruciferous vegetables. That's where it's going to be most abundant. You're also going to find a healthy dose of vitamin D, vitamin K, vitamin A in organ meats. So liver, heart, even eating kidneys. These are really great ways of getting these macronutrients, these macro vitamins in your healthy body. And so the other thing the study found is that activated MGP, which is, once again, it's a matrix GLA protein. It binds excess calcium and removes it, reducing the risk deposits in vessels and arteries, as well as bone spurs. Studies have documented the beneficial effects of vitamin K2 supplementation for improving cardiovascular health and reducing bone spur formation. So this is, there's a double whammy there, because still heart disease is a bigger killer than cancer is in our country. And if you're over 80, you guys have heard me talk about this, then Alzheimer's becomes the biggest threat to your life. So get your brain healthy, and you can't have a healthy brain if you've got calcification in your major arteries, because it's the blood supply that keeps your brain alive and healthy and activated. So once again, they've got an image where they show that the MGP is an important inhibitor of calcification in the soft tissue. So really important. If your muscles get really sore, if you notice your tendons pop a lot, you get really stiff, then you need to get on some vitamin K2. Absolutely, get on some vitamin D. So really important and critical aspects of it. So here's what some of the studies have found. Just 45 micrograms a day of K2 can statistically reduce the risk of prostate cancer in men by 60%. So that's huge if you think about it. I don't want prostate cancer, Cade. I know you don't.
Yeah.
There's some nasty side effects to that, including wearing Depends if it gets deep enough.
Yeah. Well, so where any specific recommendations for a source for K2, or is just general supplementation pretty safe?
Supplementation is very safe. I mean, I wouldn't go more than about 300 micrograms. Once again, that's a higher dose. And as far as sourcing goes, Thorne is a great source. Designs for Health for vitamin K. These are really good sources for vitamin K, vitamin D. My favorite vitamin D is made by Natural Stacks because they make it from coconut. I like to see the food source of where things come from. I think that's so critical, and so that's the vitamin D that I use. And I tend to do where I'll do about 5,000 international units every day, and then once a week I'll do a high dose. I'll do like 50,000 IUs, and so that seems to work for me. All right, so here's some things you can do, some foods you can eat if you want to increase your vitamin K. So you can eat salad greens, dark leafy greens, grass-fed butter, grass-fed beef and lamb, egg yolk, fermented foods. These are all amazing sources of vitamin K. And I ate a bunch of leafy greens today. I have had no grass-fed butter. I actually got tired of putting butter in my coffee. So I had not had it yet. I know, it's crazy. I just the flavor. I don't know what happened. All of a sudden, it was like something triggered in my brain. Maybe I'm butter saturated. I just got saturated with butter all over.
You got too much butter in you. So
I was rolling in it for like 6 years, and then all of a sudden, I was like, oh, I can't do it anymore. So not had that yet today. I had grass-fed beef yesterday for lunch from our patient in St. George who has the cattle ranch. Egg yolk yesterday, fermented foods yesterday. So yeah. So how about you? Are you on track, Cade, to get your vitamin K levels built up?
Yeah. Yesterday I probably had like 2 pounds of leafy greens, and I didn't have any beef yesterday. I did have some egg.
Nice.
And I had some sauerkraut. So yeah, I'd say I'm trying to build up a broken foot, so I gotta build up a lot.
You got to get this rocking, and we don't want Cade to have prostate cancer.
No,
that means more prostate checks for you, buddy. All right, so if you look at lethal doses, so this is where people, you guys are like, well, whoa, 30,000 IUs of vitamin D, Regan, is this safe? And here's where it's been tested, and they tested this on dogs. I'm not a huge fan of animal testing, but it is, it's better than testing it on kids, which Danny jokingly said that that's where they tested. I was like, what? But it was not on kids, but it was on dogs. And what they found is that, lethal doses, they found that a lethal dose of vitamin D3 is 88 milligrams per kilogram of body weight. So that means someone would need to consume over 3,500 capsules of a 50,000 IU D3 in a 24-hour period. That's 146 capsules an hour in order to have a 50% chance of dying. So yeah, it's safe. If you want to get to the lethal dose, your stomach can't even digest enough of this that you could take it. Like your stomach would fill up with the capsules of vitamin D3. So what we're saying is,
and you still only have a 50-50 chance.
It's 50-50. Yeah. I mean, then you flip a coin and you're like,
that's just as safe as surgery, right?
Yeah. I've swallowed 146 capsules every hour for 24 hours. You now flip a coin, and then, yes, you're there. And
just don't do that. How
about let's not do that? Let's just trust the science here. We don't want you doing that. So it's very well tolerated, but once again, work with your physician, work with us, make sure that your kidney function can tolerate this. What you'll find is 25. So kind of the protocols that we look at, once again, make sure before you get on a protocol like this, you have reached out to your doctor or one of us here. But 25,000 IUs D3 daily for 3 to 6 months. This can go 25,000 to 30,000. And then you do 100 micrograms of K2 per 10,000 IUs of D3. So it's like it's a 100-to-1 ratio there of the D3. And so with the K2 to D3, so if you're on 30,000 IUs of D3, then you want to take 300 micrograms of K2. And then for every 5,000 to 10,000 units of D3 taken, we recommend that 100 micrograms of K2 to prevent the inappropriate calcification of the higher doses of D3 alone can cause. So very interesting. The biggest thing you want to be aware of is toxicity, sensitivity issues that can arise with consuming D3. Once again, these can be mitigated by checking your D3 levels, your vitamin D levels in your blood. Keeping it around 60 is ideal. 60 to 80 is where we like to see it, not really above 80. We don't like it to drop too much below 60. And then if you're on blood thinners, this is a big thing that you need to be aware of. Do not take vitamin K2. It can thin your blood. You'll read some of the things. If you're on Coumadin, warfarin, Plavix, if you've had a heart attack, look at your medication because you may be on blood thinners. And that would be a contraindication of using the vitamin K2. Even eating some of the leafy greens like the cruciferous, because they're so high in vitamin K, that could pose a threat to you, because we don't want your skin to be so thin that you tap something and then you end up bleeding. Or if you happen to get an accident, have a cut, the clotting factors won't be there, and so it'd be very hard on your body. So this is an easy way to not thinking outside of the box. Like, maybe I don't need surgery. Maybe I could try something else to have that bone spur dissolved and mitigated. We found that if we can do PRP and ozone in the area where you've got the bone spurs, add a little acupuncture, those are great ways of keeping that connective tissue healthy. But really appreciate you guys being on this today. Cade, any final thoughts or questions before we close out?
Awesome. So just final thought is wanting to know how and where to go for supplemental testing. So ultimately it'd be the office.
Yep.
Coming to the clinic, you can do a lot of different nutritional testing, and we can fine tune those things. So give the office a call, whichever one's closer to you. Our website's acueastwest.com, and you can find the location nearest you. We love you guys. Thanks so much for joining us today. You have an amazing day. We'll be back same time, same place next week. See you, Regan.
See you guys. Bye-bye.